Hi, and welcome to Ancient Fertility. I'm Lukisa Denise. I am a trained and certified fertility optimization coach or fertility doula. And this channel is dedicated to educating you about infertility and hormone optimization. In today's video, I will be discussing the link between the parasympathetic nervous system and our fertility and how they connect. If that interests you, stick around. The first thing I'd like to discuss is what is the definition of infertility? Infertility is defined as the inability to conceive or stay pregnant. If you are 35 and over, that time frame is within 6 months. If you haven't been able to conceive, you may be diagnosed as infertile. If you are 35 and younger, if you have been trying to conceive for 1 year and have not been able to conceive or stay pregnant, you may be diagnosed as infertile. 1 in 6 couples experience infertility, and many of those couples opt to go the medical intervention route. And we'll discuss what that medical intervention looks like and the different interventions that are available in another video. When a person has gone through several diagnostics and different blood testing, and there hasn't been an issue able to be found, that person may be diagnosed with unexplained infertility. It's important to note that unexplained infertility doesn't mean that there is not a reason why you are not becoming pregnant. It simply means that through diagnostic testing, there hasn't been able to be found an issue while you are not conceiving and staying pregnant. Alternative therapies such as hypnosis, yoga, therapy, acupuncture, these are all very helpful for anyone who is having trouble conceiving, but certainly for people who have been diagnosed with unexplained infertility. Now, let's get into demystifying the parasympathetic nervous system. What is it and how does it work? And what does it have to do with our fertility? The autonomic nervous system has 2 main divisions: the parasympathetic nervous system and the sympathetic nervous system. These 2 pathways work very well to keep our bodies in balance or homeostasis. We are constantly moving between cycles of arousal and relaxation. And when we spend too much time in the sympathetic nervous system, we allow basic body functions to suffer. Fight and flight is not an optimal state to be in. In our society, we tend to spend more time in that state, but it's not optimal. Just as sitting in traffic in your car in a traffic jam on your way to work or on your way home from work is not optimal, so is the same when it comes to living for days and days in the sympathetic nervous system in that fight and flight mode. It simply is not optimal for your health and balance. The good news is, with some intentionality and a little practice, we can train our bodies to return to the relaxation state, to that parasympathetic state, and allow our bodies to rest and digest and bring balance in a way that is optimal for the functions of the body, including reproduction. When our bodies are in that state of parasympathetic nervous system, in that relaxation state, we sleep better, we breathe better, and we digest better, and we reproduce better. People who are trying to conceive are constantly triggered into that stress state. It's important to learn tools and techniques that you can use to activate that parasympathetic state, especially when you are trying to conceive and everything around you seems to trigger a stress response. If any of this sounds familiar, or if any of it inspires you to want to have help to manage any of it, feel free to click the link below and schedule a free discovery call consultation with me, and we can discuss some of the things that you are struggling with along your fertility journey. In my practice, I primarily focus on techniques such as breathing exercises, mindfulness, meditation, and relaxation practices that encourage us to cultivate a practice to lean into the parasympathetic nervous system. The tools and techniques that I teach can be used as a regular practice, and also whenever acute situations arise, like doctor's appointments, infertility treatment, things of that nature. The next point I'd like to make regarding fertility and the sympathetic nervous system is hormones and stress and how they play a role. According to Alice Domar, stress is not the reason for infertility, but it can certainly add to the problem. Simply relaxing does not cure infertility. If you have blocked tubes, high FSH levels, male factor infertility, extreme endometriosis, relaxation will not cure that. You can have all the relaxation tools that you'd like to have and still not be able to experience spontaneous pregnancy. However, there is a link between stress and infertility. In a 2011 study conducted in the UK, over 8 endocrinologists tested the hormone levels of many people trying to conceive, and the evidence was that there is certainly a link between relaxation and the probability of conception. So let's talk about the endocrine system and hormones. The endocrine system is a collection of glands that secrete as well as produce hormones within the body. The endocrine system works closely with the nervous system in order to create this optimal balance or homeostasis within the body. Many of the bodily functions that the hormones secreted into the bloodstream from the endocrine system, many of those body functions that those hormones control are growth, metabolism, temperature, respiration, as well as reproduction. My goal in my practice, as well as on this channel, is to focus on the endocrine system and how it relates to our hormones and reproduction. Now let's shift to some practical tools and techniques that you can take away from this video and begin to use today to help you along your fertility journey and recognize where you are. Everyone's goal should be, how do I activate the parasympathetic? How do I get back into that state of relaxation, that state of rest and digest? And I have a simple exercise that I'd like for you to do, if you'd like to, that will help to locate you and see just exactly where you are along that spectrum of sympathetic and parasympathetic. Take a moment to think about a time that you were in the sympathetic nervous system. I mentioned a traffic jam before. Were you in an argument with someone? High stress, anxiety? Is it your job? Is it your family? Think of a time when you were in the sympathetic nervous system. How does your body feel? What bodily changes are you experiencing? Are you experiencing sweaty palms perhaps? A rapid heartbeat perhaps? Sweating? That fight or flight? What's happening in your body? And now take a moment to ask yourself, how often am I in this state? How often do I feel this way? Now again, think of a time when you were in the parasympathetic nervous system, when you were more relaxed, when you were in that rest and digest state. Maybe a spa day, a massage, reading a book, going for a walk. Think about a time when you were in the parasympathetic nervous system state. And how does your body feel in that state? Do you notice any bodily changes? How's your heart rate? How are your palms? Are you sweaty? Are you nervous? Or are you relaxed? How's your breathing? And when asking yourself these questions, do so without judgment. Just let the questions be answered by your internal wisdom, without judging, without thinking, I should do this, I should be doing that. This is just an exercise that allows you to locate yourself as you are on your fertility journey, trying to conceive how much time are you spending in the sympathetic versus the parasympathetic state of being. Here are my final thoughts on the topic. As I've stated earlier, trying to conceive can trigger a stress response in many people. And when that stress response is triggered, the endocrine system releases a flood of hormones through the body, namely adrenaline and cortisol. And when there is a presence of adrenaline in the body, it signals to the body that this is not an optimal time to conceive. So you can see the link between the stress, the hormones secreted because of stress, and how that interrupts that homeostasis or that balance within the body and signals to your body it's not a good time to conceive. When those stress hormones are flooding the bloodstream, it tells the body that it's not a good time to conceive. This may lower the production of eggs, your ovulation in females. In males, this can reduce sperm count, and it interferes with the libido of all people. And that's all for this video today. I hope you found it informative. If you did, please take the time to give it a thumbs up. If you are trying to conceive and are on a fertility journey and you'd love more information like this that is informative and comes from a trauma-informed, educated standpoint, please consider subscribing. Lastly, if you know anyone who is trying to conceive, please share this video with them. Come back to the channel often. The goal is to upload a new video every week, and you can always shoot me an email if you have questions. Also, feel free to check out the description bar that explains everything that I talked about here today in this video, and there is also a link there if you would like to if you would like to schedule a free discovery call with me to discuss where you are in your fertility journey and how I may be able to help you. That's all for now. I'll see you in the next video. Bye.